السلام عليكم. أولًا نشكركم على تسجيلكم وحضوركم معنا اليوم في Future Pathways، المحاضرة بعنوان Physical Medicine and Rehabilitation in USA بتقدمها الدكتورة سارة محاسن. إذا عندكم أي سؤال تقدرون ترسلونه على الQ&A box بأي وقت، بنجمع الأسئلة ونسألها للدكتورة إن شاء الله في نهاية المحاضرة. والآن دكتورة سارة راح تبدأ المحاضرة، تفضلي يا دكتورة.
شكرا. Assalamu alaikum jameen. So I'm really happy that I get to share my experience with you all. So I'll be talking about PM&R in general and how is the training in the US and like tips and tricks through the application process. Oops. Goodness. All right, so a little introduction about myself. So I graduated from King Saud University. I'm an معيدة مع جامعة الملك سعود in the Department of Orthopedic Surgery. I did my master's degree in the University of California in San Diego. Currently, I finished my prelim internal medicine year at KSUMSC Reserve here in Ohio. And I'll be an onboarding resident in the University of Minnesota in the upcoming class. So things I'll cover in this lecture. So I'll just go briefly over what is PM&R. Dr. Maha gave us a quick overview. I'll just reiterate some points and common questions about the field. I'll talk about the program structure and I'll touch a little bit about the preliminary year since it's a requirement for PM&R. Give you some reasons about what to consider if you want to train abroad. And I'll talk about different components of the residency application here in the US. And I'll give you a little bit of my experience and just to give you an idea of things that you might go through and some resources that I'd like to share with you all. So what is PM&R? As we mentioned, it's basically a specialty that focuses on the patient's function. So mostly patients with disabilities, as a result of their disease, if they have a disorder or they've, had an injury. So it addresses the function of the whole patient, and a lot of our focus is on the quality of life. So there's a lot of conditions that you can deal with in this field. They can be acute and chronic. The big systems that we work with mostly is neurological and musculoskeletal aspects, but there are some other, lesser known fields such as cardiopulmonary diseases. We also deal with different conditions that patients might have, such as traumatic brain injury, spinal cord injury, burns and spasticity. We also deal with like special populations. So you have your pediatrics and, maybe some athletes in sports medicine. And you can keep going on and on. There's so many specializations. So I mentioned here, like for example, patients who've undergone transplant, who've undergone surgery or are recovering from cancer. So what is exactly a physiatrist and what is their role in a medical team? So physiatrists are team leaders. They're the one who lead a multidisciplinary team. They provide medical care to the patient. So in terms of different conditions such as pain, weakness, and loss of function. And the goal of providing all this care is for the patients to make sure that they maximize their physical ability and their potential psychologically and socially as well. So nice thing about the patients that we take care of, that we think about not only the medical aspect but their social aspect as well. So we also make and manage medical diagnoses and prescribe therapies, prescribe medications that will help them along the way. And since patients are usually that we deal with, they have chronic conditions, we build a long-term relationship with these patients. So what I put here up a picture, I think from the University of Virginia, which I'd like to show that it takes a lot of people in terms of helping a patient with disability in terms of or with a functional issue and helping them along the way. And the goal is to make sure that when they go to their environment, that they can have some level of normalcy or can depend on themselves. So as we mentioned before, PM&R is a very multidisciplinary field. So you work with a lot of people. So you have overlaps with people in different specialties. So you have colleagues in neurology. Since we refer patients, we deal with similar conditions. But our focus is a little bit different than those fields. For example, you have psychiatry, patients who have had traumatic brain injury and mood and they could have issues with inhibition or aggression. They help a lot with that. Or disability is very traumatic for some patients, so mood disorders are very commonly treated as well. So other fields, so for example, orthopedic surgery, neurosurgery, plastic surgery, neurology are some of the common services that we work with. As well as other, very important people that we work with is the therapists. So they very much are that we work very close with in terms of helping our patients getting better. So I've listed, a few of the many people that we work with, just to give you an idea of like how much you have to have a good teamwork. So what kind of settings would you expect to work in as a physiatrist? So I'll start with the inpatient one. So just to give you a brief overview, it's similar to a general medicine kind of treatment. So you have your patients on a ward, you round on them and you treat their medical issues. Patients, for the most part, have to be medical stable to participate in therapy, and inpatient therapy is it's intensive. So you need them to participate in at least 3 hours of therapies throughout the day. So things we focus on is making sure they're medically stable. And a lot of disabilities, patients are prone to a lot of complications. So we focus on the prevention of that as well during their inpatient stay. It's this field, you depend a lot on communication. So we have multidisciplinary team rounds. So you do your own rounds with, the medical team, but you also do rounds with your physical therapist, your occupational therapist, the psychologist who works with the patient. All together, you sit and discuss the patient and see how you can contribute and see if there's any issues along the way. They share their concerns with you and you kind of help lead the team. You also talk with family members as well, or caregivers for the patient. So you have to moderate that, and you're a patient's advocate, and you educate the family as well. So those are the roles in terms of an inpatient setting. For outpatients, what do you do in a clinic? You get to see new patients, or you get to see, patients you may be treated in the inpatient setting that, they're done with their rehabilitation and, but they need to follow up in terms of their long-term care. PM&R also does procedures as well. So I've mentioned a few here. So things like, the EMGs or nerve conduction studies, management of spasticity like Botox injections, or baclofen pump, and pain management. So things like, injections are common, or oral medications, or for example, here, like fluoroscopy, you have the, over here, like the spinal, some spinal injections or nerve blocks that there's an overlap with anesthesia. And that's something that is an aspect of PM&R. So that's just a quick overview of their specialty. I'm going to give you a quick, overview about the residency program here in the States. So it's a 4-year residency program, and I'll start with the first year. So first year, it's unique. It's called internship here in the States. So as a PGY1, it's a requirement that you are enrolled in something called a preliminary year. So it's a 1 year where you undergo clinical training, either medicine or surgery. And just so you know, it's a separate application, separate interview, and you don't have to be in the same institution, which is similar to my case. And your role as an intern, you're the first line, you're the most junior doctor, but you get to, you have your patients, they're assigned to you, and you get around them, and you're responsible for, their care, basically. You have a senior with you who helps you in developing the plan of the patient. So according to the American Council of Graduate Medical Education, just to give you an idea in terms of the workload, excuse me, their policy is that residents shouldn't work more than 80 hours in 1 week, and you'll have at least 4 days off in a month. So it's a very difficult stage in your training, since it's your first year, you're adjusting to a new environment and you have a huge workload, but it does teach you a lot. The reason I chose medicine as my prelim year, because there's a lot of overlap in terms of treating patients and physiatry. So that's your first year. Then you have what's called the later part of your, or the bulk of your residency, which is for PM&R. It's from PGY 2 year to PGY 4. So starting off as, as the PGY2, a lot of your rotations are more inpatient focused, and then later on you get more elective and outpatient time. So the core rotations, it's very similar to the ones of the Saudi. So you have, the patients that you'll manage with the stroke, brain injuries, spinal cord injury. You'll have a rotation in pediatrics, dealing with different medical conditions, some general neuro rehab as well. And then you have the more musculoskeletal component related, for example, to either like surgery or polytrauma, amputations, patients who've had fractures, for example. So later on in your training, you get more consultation, more clinic time, and you can get to do procedures. I've listed a few that is required as part of your training. So you have your, your nerve conduction studies, your injections. Ultrasound is also a component of the residency training program, as well as spasticity management. So these are different things that you might be doing, as well as interventional spine as part of the training as well. So here is a logbook from my program that I'm going into. So it's kind of, so it covers different procedures and the minimum requirement that we have to do to kind of graduate from the program. So as you can see, there's different kinds of procedures. And there's a minimum requirement for each of them. Of course, depending on your interest, you can do more electives, you can do more of these, and it depends on what you want to focus on your scope of practice down the road. But that's something all residents will have to do in the program. So what other things do you expect from the residency program? In terms of the education that's provided, from what I've seen, it's pretty much consistent, or at least there's some things that are similar. So there's weekly half-day didactics. So once a week, you have teaching from 8 to 12. It's given by either the residents or the attending physicians and the facility that you're training in, so to cover some topics related to rehabs or specialties that work closely with rehab. You have your grand rounds. Residents would present things in the journal club. Board review is a big component of the training. They have some other lectures and workshops. And part of your training is that there's an annual exam that's done, just to see where you are in terms of where you should be in terms of your learning and if you're achieving those goals. Research is also a big component of the training. So for most programs, research is expected from the resident. You don't have to publish, but you have to work on a project. You have to show that it's being contributed somewhere in a conference, for example. But definitely they do give you a lot of opportunities to publish whatever work you have, and if you have an interest in the academic side of medicine. The types of hospitals that you could work in, I put in some different terminologies, and I'll go over them real quickly, what each of them means. So when you're looking into programs, they might mention things like there's training in academic hospital. Usually this is a higher level of care, and it's tertiary center. You get to see different populations in that kind of setting, maybe more complex medical issues. Community hospitals, the hospital within the community, it's where they refer patients to the academic hospital in most cases. Specifically here in the States, there's a Veterans Affairs hospital. So this is it's a hospital for veterans, people who served in the military. So you get to see variations in terms of people who are affected in different types of injuries. Also, they some programs might have clinics in underserved areas. So, the pros of having a lot of programs have different centers while you're rotating. And the benefit of that is that you get to see different levels of care throughout your training. Now, I've mentioned a few things like the on-calls and vacation days. So these varies from program to program, but for most part, on-calls, they could be home calls starting from your second year. So we don't have the concept of senior or junior resident, even on the floors. So there's only one resident covering a floor at any given time at any different level of training. You're on calls, for example, my program is a home call, and you carry the pager for a total of 2 weeks in a 3-month rotation. But some hospitals might have a night float system. Some of them varies in terms of how long you hold the pager. So that's something to look into. But very few programs require you to be on site. Same goes for vacation days. I'd say give or take, you have like 30 days, about 30 days off in a 1 year period. So generally the lifestyle of a PM&R residency, as you've mentioned before, it's not hectic. You have a lesser level of acuity. You deal with stable patients, and they should stay stable to participate in rehab. So it's more chill compared to other specialties. So once you're done with your training, what are your options in terms of subspecializing? So I've just mentioned a few over here. So you have your big categories like spinal cord, TBI, sports medicine, and interventional medicine. So those are two. Sports and interventional are the more competitive subspecialties in the States, given that there's more outpatient focus and there's a lot of intervention that you can do. And of course, there's other things like neuromuscular, pediatric rehabilitation, and on the left, on the right, sorry, there's other subspecialties that you can focus on, and there's many, many more. Basically, I think when it comes to PM&R, the world is your oyster. So it depends on what you're focusing. You can subspecialize in that, given that there's a lot of opportunities for training. So one of the questions is, why would you want to go abroad and train? So I guess for me, one of the factors you should consider too is the quality of teaching. You have a lot more faculty, a lot of more experience in teaching, and there's more activities, and you have close access to a lot of the knowledge that's there. There's different sites that you can train in. And even later on, in terms of pursuing a fellowship, you can take your pick in terms of what you want to do. There's a lot of opportunities in research and in academia. So this is more established there, and having a board certification that's that's well known is also good. It's something good to have in terms of if you want to develop your career further. So I guess these are some considerations that you have to take into mind if you want to pursue a training abroad. So you've made the decision, let's say that you do want to go abroad for your training. What do you have to know in terms of your application? So I'm going to go over a few terminologies that's related to the application process here in the US. So you have the ERAS, which is a website where you upload your applications on. That's where all the graduates, medical graduates apply for residency as well as fellowship. So to touch on a little bit about residency, on the right is the table with some of the deadlines for this year's match. But just to give you a brief idea, usually they open up in June. You can start uploading your application. September, they start sending out your application to programs. And then that's during that time until January, February, you get invited to interviews. And then March is when the results come out. So that's kind of the time frame you should have in mind, and definitely keep an eye out for updates, especially now with the era of COVID. Things are changing on a regular basis, so definitely keep an eye out in terms of if deadlines are changing. Another thing you should be familiar with is the NRMP. So that's a separate website that you do your rankings in. So once you get invited to interviews, you go to this website and kind of think about the programs that you interviewed and which one would you prefer to go into. And programs do the same as well in terms of ranking their applicants. Again, look out for updates if you're applying this year. And what's nice about this website too is that they mention they gather data after the match and kind of give you an idea of what they're looking at in terms of the applicants who matched. What are their characteristics? So this is one of the tables that's mentioned in the NRMP. So they split the table into, you can see here, U.S. graduates, U.S. citizens who are international medical graduates, and non-U.S. International medical graduates. So they subcategorize them further into matched and unmatched. And so this is just a good way to see, where would your score should fall around, or if you want to work in terms of aiming, what's the, a safe score to get into a program. So this will give you an idea. And again, this is data from 2018, so it might be very different given compared to others, but it's somewhere to start. And as you've noticed, that not a lot of people apply for PM&R. I guess it's a lesser known specialty, and it's it takes a lot to just apply to these programs as well. So these are just some data points that keep in mind and see what people who match, how does their application look like. This is a good overview. Here's another table graph, sorry, that will show you in terms of the step 1 score. So they break it down even further. So I just put over here like what's the pass score and what's the mean in general for this exam. And as you can see from the graph, the blue one shows that people who match, the green ones, the unmatched candidates. So the higher your score, the better your chances. But keep in mind that the score is not the only thing that they look at. Is an important part of your application, but just remember it's not the only thing. This goes for as well your the step 2 exam. So you have your clinical knowledge here in this graph. Again, I put in the score that the minimum that you should have, and what's the mean or the average that in general that people are scoring in this exam. And the same concept as well. The higher you score, the better your chances are matching. So this is for US IMGs, and this is for non-US IMGs. So once you have those concepts in mind, how should you work on your application? So I'd break it down to, first of all, your CV. So what exactly do they count in your CV? So there's a section for work experiences. Things you can put in there are your electives that you did in PM&R, which is something I would highly encourage. So it doesn't matter where, as long as you do something, just to get the experience, because it's it's one of those fields, like no matter how much you talk about it, it's very hard to conceptualize it, given that, we didn't have this experience in medical school, and, we just find out about it, from word of mouth in general cases. So doing electives like in KSUMSC, the Military Hospital, National Guard, is a good start. If you want to do electives in the US, so this is a database with all electives that are available, and you can kind of narrow it down to geographically and requirements. So that's something I would encourage you to do and look into. There's a lot of centers that take international students. There might be some requirements that have to be in your last year of medical school, which is for us is the internship. Or you can do it in your 5th year of medical school. And you can do that time when you have your elective. Not all programs require things like your USMLE. Some just require you to pay a fee or just fill out an application form to start the process. So you can take a look into what things are available there and kind of, just go and experience and see what's different out there. Other things I can consider as your work experience is your internship, any observerships you've done. If you've done anything postgraduate as well, you can mention that too. So those are the big components of working experience. Other things that they mentioned, there's a section dedicated for in your CV is volunteer work. So, things that we do in medical school, like health campaigns, those count. And also, I'll just want to mention that for King Saud University, we have a PM&R interest group. So that's something that can count, and especially gives you more interaction with the field of PM&R. Other things you can mention in your CVs, any awards that you've got or any previous trainings that you went through. Another important part is the research, of course. So you can mention things like, your publications, if you submitted any abstracts to any conferences, if you presented anything in the conference, either a poster or a presentation. So you write a small, description of which conference you went to, which date, what's the title, and those are things that are mentioned in your CV. I just want to take a minute in terms of mentioning things like predatory journals and conferences. So I know there's lots of pressure for medical students to publish a lot of information and or just so it can count as a point to their CV. So things that I've noticed with some is that they apply to some journals that only asks for a fee and gives you, they're like, we'll publish it in a few weeks. So if something sounds too good to be true, it's most likely a predatory journal. So the problem with that is that if you do send your work to a predatory journal, there's no way of getting that work back or publishing it anywhere else, but you didn't publish in a credible journal, so it kind of hurts your work. So that's something that I just want people to know about. And there's also predatory conferences where you submit their work and it turns out there's no actual conference. So just be careful of that, especially if there's something you worked very hard on, you don't want it to go to waste, and take the extra time to go through, do your research, apply to legitimate journals, ask around. There's some websites that help you in terms of finding a good journal to publish your research. So that's something you should keep an eye on because it's a lot of hard work and you don't want to go to waste. So the conferences that you can, attend or present at, I've listed a few here in the States. And there's many more. I'm not familiar with the ones back with Saudi, but you can always take a look and look at their annual conferences. There's also the International Society of Physical and Rehabilitation Medicine. So that's more of a, you have a bigger audience. So these are some options in terms of if you're looking into spreading your publications. So I just mentioned here just to give you an idea about how your CV would look like in ERAS. So, so this is an example of my work experience as an intern. So you mentioned over here, for example, which institution, which city, what's your role, and who is your supervising doctor. So the idea bring this up is that how would you bring information or your experience and show it to another healthcare system, or like trying to give them a better idea of what your training looks like. So you mentioned duration, like it's a 1-year internship at which hospital. I mentioned, how many beds there are just to give an idea how big the hospital is. You can mention what rotations you've done. And since mine is targeted for PM&R, I've mentioned that my electives were both in PM&R. You have to elaborate more in terms of what you do in the as part in your role. So as an intern, what do you do? Because also we use intern in a different context. They use it as a first-year resident. We use it as a last-year medical student. So so you mentioned things like what do you do, what kind of environments you work in, what's your role with patients, and what do you do most of the day in terms of like writing notes? You present things and different activities that are available in the hospital. And when you say things like your on-calls, you can mention a little bit in detail in terms of what that looks like. So this is just a small example, just to give you guys an idea of how your CV would look like. So another component of your application would be your letters of recommendation. So on ERAS, you can upload as many letters that you want, but every program that you apply to, the max is 3 to 4 letters. So basically you ask your letter writers that you want a letter, and they would write it, they'd upload it to the website and you can't see it. most of the programs, I recommend that at least one of those letters come from a physiatrist. And I would recommend that you choose someone who knows you very well, who can, comment and in detail about your clinical skills. You don't want anything that's very generic and that can hurt you in a way. So someone can, that worked with you very closely and knows your, how's your clinical skills, how's your communication skills, like they can comment on a specific moment that they found that you did well. And also ask as soon as possible, given, anytime you ask for a letter, just give the letter writer some time to formulate a nice letter for you. Also logistic wise, just because it takes time for them to upload it on the website, and it takes some time to be released from ERAS as well. Another component of your application is the personal statement. I know a lot of people dread this part of the application, but just briefly, try to stick to a one-page essay and try to kind of tell your story in terms of why you're going into this field. Why do you want the specialty? What can you contribute? What are your plans in the future? Was there a specific moment that you remember that made you want to go into this field, or any specific experiences that you've had that's led to the decision of pursuing this field? And everyone has a unique story. You just have to kind of dig deep and kind of figure out, why you want to pursue this. The reason being is that that program directors do look at those applications, and it does play a role. It just makes them get to know you a little bit more. So definitely avoid, when I say rewriting your CV, the committee has your CV already, so you don't want to reiterate the same points. You can mention things from your CV, so like you did an elective, but you can say things like, I've had this interaction with this patient, and this is what I learned from it, and this is why I want to do PM&R. And definitely avoid things that can hurt you in terms of, making it too generic, getting very cliche things. You're talking to, people who specialized in PM&R, so they know about the specialty. So, those are some of the things that you have to keep in mind when you're writing your personal statement. So another component as well is your exams. So for the step one, I just wanted to mention that it's going to be pass fail, and sometime in the future. I know a few speakers brought this point up before in other lectures. But I just want to mention that, in terms of when to take your exams, it's basically whenever you're ready. If you've been studying and you're ready to take it now, go for it. There's this article in JAMA where these authors speak a little bit about in terms of the decision to go into pass-fail and what does that mean for the medical education. They do touch upon like what does it mean for IMGs, and basically the bottom line is no one knows how this will affect the match, if there's different parameters that they'll look into. So I wouldn't worry too much or say things like wait until it's pass-fail, or like no, you have to do it now because the numbers help you. There's no it's all speculation at this point. So just have this, just know that this is something that's going to eventually happen. And if you're going to take your steps, basically just prepare for it very well and use the resources that are available, and just take it whenever you're ready, whether it's now or is in 2020. So that's my take on the step one right now. It's the most difficult exam, and I'd recommend taking that first because a lot of the subsequent exams would depend on your basic sciences knowledge. So then you have your clinical knowledge, and then you have your step two clinical skills. Whoever's preparing for it, just so you know that there's some changes going on with COVID, and it's suspended for now, possibly until the end of the year. Once you have those three exams done, you'll be ECFMG certified. So that's an important part of your application too, just so you know. Being certified means that you've completed your exam and you're ready to start residency, and that's something programs look for. They also look for, the number of times you've tried the, you've attempted the steps, and if you failed, they do know that. And I just want to mention step 3 here because that's also the final step that you'll take, but that's something you can do during residency. It's not necessary for your application. So this is another, sheet from the NRMP. This one goes over like the program directors answered some questionnaires. What do they look into in terms of selecting applicants? So there's some factors here that will get you an interview invitation. So the people who answered, they said that things like letter recommendations important, your step 1 score, how committed you are to your specialty, and they look at the personal statement too, among other things. And they mention here also in terms of how they rank the applicants. So after they meet you in an interview, what do they consider very important factors in terms of ranking their applicants? So they look at how you interact with the faculty, how's your interpersonal skills, and how did you interact with the rest of the residents that you've met with that day? So those are some of just some data points you can take a look into. And they also look into in terms of, the USMLE, do they look at pass only if you passed your exams, or do they look into if they have a target score? So again, it varies from program to program. And these are just, just to kind of give you an idea what you should do in terms of preparing for your application. So when it comes to the interview, my general advice would be prepared. Things that they want to see in the applicants, that about their program, what you're getting yourself into, and your own CV very well, so you can talk about your work experience. You can talk about your research you've done in a very concise manner, and it kind of shows you straight to the point that what you're interested in and your passion for the field. There's a dreaded question, of course, about tell me about yourself, but take that as an opportunity to kind of tell your story and let them get to know you as a person. Be ready to address any gaps in your CV, or if there's any issues that they might consider as red flags. So one of the things could be, prolonged time from graduation to pursuing training. They don't look for it, but they could ask you about it. Most of the interviews are they're very relaxed and very informal, and very few programs ask about medical knowledge. So it's mostly about getting to know you as an applicant. And they already know most of your background given your CV, so they know what level of training or what they expect from their applicants. Just be yourself and try to be natural, and kind of make sure that you get to know everyone and have a good sense. And it's an opportunity for you to get to know the program, and of course, have some questions ready about the program. So one point that I want to bring out is about emailing the program, whether it's before or after the interviews. So generally you can ask the programs, and reach out to them and say that I am interested, and you can kind of write a brief email about how you'd like them to consider you as a candidate. There's just make sure that the way you phrase it shows that you're interested, and that shouldn't be an issue. Some programs after an interview don't allow any communications. So that's something that you should keep in mind, or at least look up in the website if that's something you should be aware of. Again, because of COVID, things are changing, and the interviews for this upcoming match is going to be virtual. So mostly it's going to be telephone, or, things like video interviewings. So once you're done with your interviews, you start ranking your programs, and that's through the NRMP website. So factors that get, you should, you get all the programs you interviewed, then compare all the programs, see the pros and cons. I'd say when it comes to ranking, wherever you are in the world, just rank the programs that you want to go to. What's your first choice? Because it's all based on the algorithm, and in the end. And so, there you would rank your list, the programs rank their own list, and that's how the match works. Definitely, once you're done, there's a process that you should do. It's called certifying your list, because if you don't enter the match, and you don't want your, all your work to go to waste. And usually that happens around February, and the results come out in March. So this is a a book, or like it's a small booklet that's very helpful in terms of residency interviews. So this is a program director from one of the emergency medicine programs. So she kind of gathers what should you do before an interview, during the interview, what kind of questions that can be asked, and she gives like some answers to those questions, and examples of a good answer, a bad answer. So it kind of gives you a sense of how to prepare. There is also a section dedicated for international medical graduates, which I liked. So that was very helpful as well. Okay, so I hope I gave you a quick overview of what to expect in terms of the field, the residency, and the application process. I just want to bring up my experience a little bit. It was PM&R is not a very well-known specialty, and I haven't, been able to find any, people who've made it outside. You get to know people from internal medicine or other surgical specialties, who've made it, and you can kind of ask advice from. So I had to find my own way, and I just want to bring it up just so you guys can know, what are the options out there, and how can you, if you want to pursue this path, what can you do? So for me personally, I graduated from 2014, or sorry, in 2014. I was in my 5th year of medical school, and that's how I found out about PM&R. So it was through a event that's similar to this. So it was Dr. Fatma Ibrahim, who was a resident at that time, and she's now a consultant. So I got to learn from her in terms of what PM&R was, and that got me interested. And that's what drove me later on to do electives. So my first elective was in the National Guard Hospital. I got a little bit of a sense of what's, what the field is, and, how does your workflow goes. Then I went on to KSUMSC as well. And, that gave me more experience, and in terms of, and it solidified that I really want to be in this field. So as part of my elective during internship, I applied for a spot at Spalding Rehab Hospital. So it's in Boston. It's part of the Harvard University network. So I put up the picture over here that this is the building for Spalding when I was an intern, and this is a view from the outside hospital, which I got, and it's nice about this experience is that I got to see, what was similar, what was different in terms of practice of PM&R. You get to see like the different, stuff that's available. So like I got this picture working with a recreational therapist who was teaching a spinal cord injury patient how to ride a bike, and they asked me to tag along, and I was using a modified bike. So that was a very interesting experience. You get to see things like how the inpatient work. It's very nice that since it's a big network, or it's a very prestigious name, that you do get to see a lot of experts throughout the world. And you kind of attend their lectures, and you get to see, the knowledge that's shared. So that's why I decided to become a demonstrator. So I'm part of the Department of Orthopedic Surgery. It's part of the initiative kind of growing the field. And eventually, the plan is to have the own rehab department at King Saud University. So I decided that I do want to have more experience in the States, and I do have this interest in academic medicine and research. So that's why I applied for a master's degree, and I got accepted in the University of California in San Diego. So it's in clinical research, and what was nice about this program is that not only did I have, classes in terms of learning how to do research, I had a mentor who was in the research, and I also had clinical mentorship. So this is a picture from my mentor, Dr. Chang. So he's he's PM&R, he specialized in sports and spine. And so it was nice to, have that introduction into the American healthcare system and kind of see like how do things work in outpatient, what's the procedure look like, taking a history, doing a physical, things like that. And kind of observing a little bit of the procedures. So with his help, it's nice to have a mentor who can guide you along the way, participate in some of the research. And this is one of the research that I published in my time in UCSD. So, it's nice to have, the access to that network, the support, and, working with other people in the field as well. And what was nice about the program too is that I got to work in outside of the UCSD system. So I did work with a mentor who is an epidemiologist, Dr. Calvo, in Scripps Hospital. And that, this is my master's, my thesis over here. So this is my master's project, and I got the chance to present it in a well-known conference. So all these experiences were very helpful in terms of establishing and getting to know the healthcare system and getting to know research a little bit more and building your skills. During my time in that program, that's when I did my step 2 clinical skills. That's something I want to bring up because you don't have to do all of your exams in a certain order. You can do something before the other. Once I was done with my program, that's when I dedicated my time for my steps. And also during that year, I applied for some interviews. So how it works, you apply for both the preliminary, the first year, and then you have separate applications just for PM&R. So when I applied that year, I just got, some interviews for just the prelim spot, but no PM&R. So that was a very nerve-wracking time because there was a chance, I could get accepted to a prelim spot. I didn't know what would happen the year after if that were to happen. So it wasn't, it wasn't a smooth track, but eventually I ended up matching in Case Western Reserve University, and it was exciting. It was my first choice. It's a very good program. It's very focused on internal medicine. And as a prelim, it's all inpatient. You don't get any outpatient experience, unfortunately, but I guess that's where you learn pure medicine. And this is a picture of my the program director of this program, Dr. Armitage. So he's an infectious disease. So of course he's he has some input during this time in COVID. So it was nice to have, a good program that was supportive and IMG friendly, and you got to learn a lot. So that's something something you should consider when you're applying. During this time, while I was an intern, I also reapplied again for PM&R, and your chances are different. I guess some things work for you in terms of you're already started training, you have the clinical experience, you're there. So you kind of have to reach out and be more proactive in terms of finding the specialty that you want. So thankfully, I got matched into University of Minnesota, and it was probably the best day of my life. What's very important in terms of this whole process is like things don't always end up smoothly, but as long as you have support, find a good network, family, friends, mentors, people you've worked with, and it goes a long way. So I guess that's my story. So just wrapping up, I hope you have a better understanding what PM&R is after this lecture. You get to know like the different settings that we work in, what different subspecialties are out there, and what procedures we do as physiatrists. Talked a little bit about the application process here in the States for international graduates, and what factors play a role in the selection committee. And basically, I want to say that your journey is your own. You make your own path. There's a lot of ways that people tell you should do, but there's no, sometimes there's no straight line or straight, there's no right or wrong answer either. So I just want you guys to keep that in mind. And here are some resources I'd like to share with you in terms of learning more about PM&R. So I like the Association of Academic Physiatrists. They do have a lot of lectures related to rehab. That's all virtual that you can access for free. Also, there's a lot of podcasts, different physiatrists talk about different aspects of their field so you can get to learn more. And I just mentioned some Twitter accounts over here so you can know, just to have an idea of what it's like in the field and like what activities are out there. So I hope this talk's been useful. Thank you so much for your time, and let me know if you have any questions.
يعطيك العافية دكتورة. بالنسبة للأسئلة، أول سؤال is how did you know that physical medicine and rehabilitation is for you?
So that's a good question. So my story is I heard that lecture and a light bulb went in my head because I like neurology, but I didn't like in terms of just diagnosing and just wondering what happens to next to the patient. Like they've had this stroke, like what can we do about it when they go home? And I liked ortho, but I didn't see myself as a surgeon. So I saw this as a very good overlap in terms of what I wanted. And I really like things that are more, patient focused care. You do that a lot as a physiatrist. You get to talk more with your patients. You get to know your patients more because in an inpatient setting, they do spend, weeks in rehab. So you have that interaction, which you don't necessarily have. So for example, my experience in internal medicine, while it's nice to see that quick outcome, patients come in with, acute decompensated heart failure, you treat them for a few days and they're good to go home. There's that satisfaction, but you don't get to know the patients very well. You just focus on the medical issue. What's nice in PM&R, you get to also focus on not only the medical complications that they might develop, but also, what their life is, what they like to do, what do they, you think about patients in terms of how would they integrate back in society, how can they go back to school, how can they go back to work, they want to start a family. So things like that, I feel like you have more of a connection with your patients, and that's what I wanted in my training.
Mm-hmm. The next question is, can you talk about the hospital environment in America and how is the lifestyle in general?
Um, hmm. I think that would vary from, state to state, from program to program. The settings that you can work with, so things you can expect, like an academic hospital, it's more tertiary, more complicated cases. They're bigger institutions, so you'll have more patients. Um, you have like the other, so for example, my program, you also have exposure to the Veterans Hospital. So that's a different healthcare system too. So it's more of, it's the government providing care for the veterans. So you have more social support, and insurance is very different. So you get that kind of exposure or that feel in terms of how healthcare is delivered. Um, and I guess the patient load depends from program to program as well. So I can't really answer that question specifically because it depends where you're going to go, and which program and what they have to offer you. In terms of the lifestyle compared to other medical specialties, it's not as hectic. You have more downtime and it's more flexible. So you can expect to go from 8 to 5. That's your work hours. For example, my program, and it's stable. You deal with stable patients. If you're inpatient, you can have anywhere between 10 to 15 patients on the floor, depending how big the wards are. And patients are medically stable, and it's you and the attending physician. So so for most part, you're just on call a few times compared to other specialties. Your patients are not as sick or, have that level of acuity that you worry about, like in medicine or surgery. So it's less hectic compared to others.
Mm-hmm. The next question is, what is the monthly allowance for doctors doing their residency in the US?
So that kind of varies a little bit from state to state. You do have, support from SACM, minimum الحقية, but your salary would vary from the institution, and it increases every year as you go up. And every year there's a change in your salary. So you can look into the websites for different programs you're interested in. Some of them have that listed if you're interested in taking a look.
Mm-hmm. The next question is, what is the difference between being a demonstrator and a resident?
So demonstrator is just الإعادة is do you mean, wait, sorry, can for that question, do they mean in terms of the scholarship or while you're working here or working with Saudi?
And I think while you're working here, but I'm not sure. The person can clarify, but you can answer that while they clarify.
Okay, so just to give you an idea, and الإعادة is basically, it's a scholarship option if you're interested in, later on academic medicine, being a faculty member with your university. So I worked a year as a demonstrator. So usually demonstrators work within their departments, but because there's no rehab department in KSU, I was with the orthopedic surgery team for a while. So I was just helping out the ortho residents and working with them during that time. And basically when you leave or when لما الواحد يبتعث and you're under their you're basically with their under theirs or you're responsible for to be in terms um, of being sponsored by the institution. So they send you out and you're going to come back to that same institution eventually.
The next question is, do I have to have a master's degree to be able to join a PM&R program in the US?
A master's degree isn't necessary to apply for any residency program here in the US. You know, people get matched without doing that extra degree. For me personally, the reason why I decided to pursue it is because I'm interested in academic medicine. I do want more research experience. I do see myself in the future, you know, working more in the academic research field. So that's why I did the program. And also that program provided me with more clinical experience. So it wasn't just, you know, just studying and having a degree. It was also working in a hospital in the States. So that was my motivation to join that program, but it's not something that's necessary for you to do.
The person that asked the previous question about the difference between residency and demonstrator said they meant in terms of scholarships.
So, so your scholarship options, you know, you can be a demonstrator, you can be with Wizarة الصحة, you can have like other hospitals that provide you as demonstrator. So I guess the difference is in terms of what you're looking in the future. Where do you see yourself? What do you, in terms of your career goals? Do you want to be in academics? Do you want to be more clinical? Do you want to have the freedom to join like any health, you know, any hospital later on when you come back? You know, being demonstrated is a commitment to the hospital that you're going to come back as faculty. So that's one thing to consider.
The next question is, are electives a must in the US? And if so, where do you recommend would be a good starting hospital for Saudis?
I wouldn't say it's a must. So, you know, there's no definitives in terms of looking into your application, but it definitely does help doing an elective in the States because you have more to talk about and you can tell them that I'm prepared to join your program here in this country because I've had some exposure. So I did put up a link. I hope you can share like the slides at some point. So there's a website that I would recommend in terms of on the AMC, there's a website that has a database of different electives that you can do. So in the States, I'd say just look in terms of, you know, where do you want to go? I went to the one that's with Harvard. So, you know, it's a good center, very well known. You have a lot of, you're seeing, you know, the best of the best. They required your CV that you have proof that, you know, you are proficient in English. I think at the time when I applied, they didn't ask for steps either. So you didn't have to have, you know, a lot of things in terms of applying. And you had to pay most of the electives, just to keep in mind, you have to pay a fee to kind of join that hospital. So I'd say definitely start with the database, you know, browse through programs. What do they require? Which places do take international students? And see if that, you know, just apply and see if it works for you.
We'll send the presentation to our Telegram channel so everyone can access the links. The second question is, having 3 to 4 years of a gap between your graduation from MBBS and residency, did it affect the acceptance in a negative way?
I wouldn't say so. Like I didn't. I know there's a gap, but during it, the important thing is to kind of address what did you do in that gap. So for me, I mentioned that I worked with the orthopedic department for a year. I did my master's for 2 years, and during those time, this is what I learned. This is what I did in the States. and I did my steps. I passed during the first try. So these are factors that they look into. They don't just look into like, oh, you have a big gap. If you had a big gap and you didn't do anything, that's a red flag. But if you've done something, you contributed to your learning, you're doing something else in your career, then that shouldn't be an issue.
Mm-hmm.
Once you have a justification for what you're doing, that's fine.
Okay. The next question is in regards to when you mentioned you have a orthopedic scholarship. They said, can you have that scholarship and still specialize in another specialty like rehab?
I'll clarify on that point. So I'm a PM&R demonstrator within the orthopedic department. It's just because we don't have a PM&R department in King Saud University. That's why I'm under that department for now.
Mm-hmm. The next question is, can you talk about the interview process?
Is there anything specific they want to know about the interview?
No, the question is just general.
Okay. So like things I mentioned in the slides, things like getting the interview, just try to make sure that your CV looks good, you send it in a timely manner. You can reach out to programs through emailing them and letting them know that you're interested. Um, let's see, SACM has some, affiliated programs, but they're all mostly prelim programs, like the medicine and surgery programs. So you can start with that. There's no affiliated programs with SACM, as far as I know. So you can kind of start there. Once you do get an interview, just be well prepared. Know your CV. Know if they can ask you things about yourself, about your work. What did you do in that time? As an intern, as a medical student during this elective, what did you do? Or they'll talk about your experience or why do you want this specialty. So there's some general questions that they could ask you. You can't anticipate every question, of course, but as long as you're prepared and you have a good good answer to things that you've done in your experiences, you should be okay. Some places where you interview at, there's like other activities. So there's like a pre-interview dinner, or there's a lunch during the interview where you can get to meet other faculties or in residents and kind of take that chance to get to know a little bit more about the program, especially when talking to residents. You can be a little bit more informal and know a little bit more detail. And it's good, if to get to know as many people, because programs do care about what other residents think of candidates. I guess those are some things that you can keep in mind.
The next question is, do you know how we can apply for a fellowship in the US?
So I guess that there's, for most training programs, there's two ways. So either the fellowship requires you to have to be certified in the American board. But if you are not, I guess you have to look for those programs. So the programs that are available through ERAS, I think it's just for those who did their American board. But if you want to, it will take a lot of searching in terms of what fellowships are available to those who haven't done their residency in the States, what the requirements are. So I think most of them require you to do your steps at least. It's a lot of digging on your part in terms of what fellowships are available to these kind of candidates.
Okay, that's it for the questions. Thank you so much, Doctor, for taking the time out of your day to present this lecture and answer all our questions.
Happy to do that. Thanks for having me.
Thank you.